So we want to look at the amniotic fluid. So basically, most of the times like this, we are looking at the normal so that we can be able to know the abnormal. So in this obstetric fluid, we get to talk about, obstetric fluid is just that environment, that water in your tummy. Literally, women call it water, right? So that water in your tummy that your baby is just floating freely. But you get to see that this water is very useful, right? Because you can see some dot is the water that helps to now, like, keep your baby. Is the most important function of this amniotic fluid is shock absorbing. A pregnant woman is moving around, so normally the baby's head should be hitting pa 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 pa. But because you have this amniotic fluid, it helps to keep the baby in one place so that you don't have all those complications. All right. So amniotic fluid, you should just know, is a clear, slightly yellowish fluid that surrounds the fetus during pregnancy. So from the definition, that means anytime you see, can you see this is can you see this slightly yellowish color there? If you see an amniotic fluid having a different yellow from the different color from what we described, there's an abnormality. So there are various things that can help you know if a pregnancy is going on rightly or not. So it surrounds the fetus during pregnancy. All right, is okay. So all right, housed within the amniotic sac. Like there's a sac. Can you see this like a balloon? It's inside that you have the clear fluid. That's the amniotic sac. It's not just a passive pool. It plays very important roles, all right, for the baby to develop and how the mother's health will keep on going fine. So what does it do? First one, shock absorbing, cushions the fetus from external pressure or trauma. All right, so it's a natural shock absorber. Regulates the temperature, keeps the fetus warm and stable, supports lung and digestive development as the fetus breathes in and swallows the fluid. It prevents umbilical cord compression, ensuring steady oxygen supply and nutrient flow to the fetus. It contains antibodies and nutrients that help to build the fetal immune system. Okay, helps your baby, get ready for the outside world. All right. So what is the amniotic fluid made up of? Early pregnancy mostly is water from the mother's body. Later on now, fetal urine, all right, along with proteins, carbohydrates, lipids, hormones, electrolytes, they come into the amniotic fluid. So there are some complications with the amniotic fluid. If it is too little, it can lead to complications like restricted growth. Like, the baby is just like, if this room is too small for me, I can't move, but because this room is big, I can move freely without clashing on the walls of the room. Do you understand? But the room is too small. If I just move a little, I'll clash on the wall. Then if it is too much, that's oligohydramnios. It's linked to gestational diabetes, fetal anomalies. As we go on, we'll talk about it more, right? So anytime you see anomalies, it's just a medical word for abnormality. Okay. So when it breaks, that dramatic water breaking moment is a rupture of the amniotic sac, releasing the fluid, often a sign that labor is near. So women will tell you that the water has broken. All right. That's the basis. That's the water that breaks. Okay. So that's it for amniotic fluid.